Hi, I'm Paul Bergner. I'm director of the North American Institute of Medical Herbalism. Uh, I'm a medical herbalist and a clinical nutritionist. I taught nutrition for some years at Naropa University and currently teach in several master's degree programs. And we run the institute here. We train students here in medical herbalism and clinical nutrition through a 2-year program. I'd like to talk today about influenza. We know there's a new pandemic strain. Swine flu is now established all around the world. It came to North America late in the flu season this year, so the effects have been mild so far. It's quite possible that in the next flu season, 2009, 2010, a large number of people will become infected with this. It's a new strain and people don't have immunity to it. So naturally, there's a lot of concern. Ever since the influenza pandemic in 1918, public health authorities have been concerned about a new, more deadly strain of influenza that may cause a lot of excess mortality. This strain doesn't seem to be an especially deadly strain so far, but because of the large numbers involved, possibly a third of the population in North America will be getting influenza, the normal seasonal death rate could easily double or triple. Typically about 40,000 people a year die of flu in the United States. It's each year. It's mainly that's in people who are malnourished. It's in elders. It's in young babies and people with various health problems that make them more susceptible to respiratory infection or excessive inflammation. Any kind of infection in the human organism, you have to consider two factors. One, you have to consider the power or potency of the infecting agent, whether it's a bacteria or a virus or a mold or mycoplasma, fungal infection. You consider the power of the infecting organism, and you have to consider the natural resistance of the host. Most of the public health measures that are being taken in the face of an oncoming pandemic of flu are focused entirely and exclusively on the virus. So what I would like to talk about today is things that can be done in order to increase host resistance to influenza or allow the person to have more moderate, milder disease if they do get infected. And the first thing I'd like to talk about is vitamin D. Vitamin D has a large number of roles in the body. Probably nearly every cell in the body has a vitamin D receptor. They control everything from immunity to bone health to blood pressure to insulin production in the pancreas and a wide variety of roles for that. Say two of the roles that have been discovered in the past 10 years are, number one, vitamin D is necessary to have robust and powerful immunity in your respiratory tract. And this is where the immune cells are produced that will fight off influenza, or if you have influenza, that will prevent you from getting viral pneumonia, or will prevent bacteria from the upper respiratory tract from getting through an immunodeficient respiratory tract and causing bacterial pneumonia. We can look at history, and in 1918, the people who died in that influenza pandemic didn't die of the influenza pandemic, of the influenza organism. Almost all of them died. It was revealed on autopsy and on clinical case description. Almost all of them died of bacterial pneumonia. So the viral pneumonia weakened them, and then the bacteria, like say from their sinus passages, got down into their lungs and caused pneumonia. So in the face of a coming pandemic, we want to be sure our respiratory immunity is optimum. And the role that vitamin D has is the immune cells in your respiratory tract. If you looked at them in a microscope, they would have proteins sticking out on their surface, actually protein parts, they're called peptides, sticking out on their surface. And collectively, we call these immunocompetent peptides. And if the cell has a healthy number of those peptides, immunity in the respiratory tract is high. If the cells are deficient in the peptides on those cells, the cells are there, but the cells can't do their job. And one of the roles of vitamin D is the precursor form of vitamin D enters into the immune cells and is changed into active vitamin D inside the immune cell, and then that substance called calcitriol causes that cell to produce immunocompetent peptides on the surface. Now normally our vitamin D levels, we get most of our vitamin D from the sun. There's a little bit of vitamin D is put in milk, and if people take vitamin supplements, they get a little bit of vitamin D there. The amount you get in milk, maybe you get 200 IUs or 400 IUs if you drank a whole quart of milk. And the amount you get from the sun, if somebody with light-colored skin sunbathes for 20 minutes, you will get 20,000 IUs of vitamin D. So most of the vitamin D we get, we manufacture in our bodies is manufactured from sunlight. Now, in order to manufacture it from sunlight, you can't just go out at any old time. You have to be out in the sun while the sun is higher than 45 degrees in the sky in order to make vitamin D. So we kind of have the vitamin D cone is from about 10 in the morning till 2 in the afternoon. And that's in the summer months. The problem occurs in North America and in northern latitudes in the winter when the sun starts getting lower in the sky. And here where we are in Boulder, Colorado, around the end of October, the sun at noon is below 45 degrees. So even a robust outdoor person out exercising in December or January with their shirt off, right, won't manufacture any vitamin D for the months of November, December, January, and February, and possibly much of March also. And this phenomenon occurs all the way as far south as Atlanta, Georgia, and Las Cruces, New Mexico. So even the southern states in America in the wintertime, people aren't manufacturing vitamin D. So the result is our vitamin D levels are higher in the summer and they're lower in the winter. And it's been proposed by vitamin D experts that the plunging levels of vitamin D, when they get down just so low, they're at their lowest point in January, February, and March. This is exactly when flu season occurs. The reason people get influenza, and the reason we have a seasonal winter influenza, is because people get low vitamin D levels in the winter. And indeed, there was a clinical trial that was run. There's only one so far. Now, as I understand, there are several more are being run right now, specifically testing vitamin D to prevent the new strain of flu that's coming around. But they gave relatively modest doses of vitamin D to one group of 100 people. Another group got a placebo, and they completely eliminated the seasonal fluctuation in respiratory infections in the people that got the vitamin D. In other words, there was no big hump during flu season of respiratory infections. So this is something anyone can do. There's a few exceptions. If you have certain kinds of cancers or autoimmune diseases, you need to consult your physician. Those conditions are relatively rare. But almost anyone can take 2,000 international units of vitamin D a day. If a person is obese or elderly or has other risk factors for influenza, like for instance asthma or something, a person can take 4,000 IUs of vitamin D a day and start taking that in October, or September or October. And this may, in that particular clinical trial, that was more effective than an influenza immunization.